Hi, good afternoon. I am Orly Primo, currently enrolled in the MS Psychology program. This afternoon, I would be presenting the three topics that I chose as instructed. Without further ado, let's start. The first topic would be about the public mental health system in the province of Benguet. The title would be Situating the Public Mental Health System of Benguet through the health system building blocks. The objective of this study is to determine the situation of the public mental health system in the province of Benguet through the World Health Organization's six health building blocks. You might be wondering, what are these six health building blocks? We have leadership and governance. We also have financing, health workforce, information, medical products, vaccine and technology, and service delivery. These six health building blocks is focusing on a whole of system and a whole of government approach and looking at the system or the health system. This is usually used in the universal healthcare approach. So I'm going to use this in my research. First problem would be, what are the accomplishments of the province and its mental health system in terms of these six health building blocks, namely leadership and governance, financing, health workforce, information, medical products, vaccines and technology, and service delivery. Like, for example, in terms of leadership and governance, what have you accomplished in terms of laws, ordinances passed to support mental health? What were your accomplishments in terms of financial investments in mental health? What are your accomplishments in terms of hiring human resources for health? Like, for example, psychologists or psychometricians to support the public mental health system. In your district hospitals, what were your accomplishments in terms of health workforce? Do you provide these types of benefits, remuneration, competitive salary? Okay, for information, focusing on the information system, what are your accomplishments in terms of saving data, data management? Okay, for medical products, vaccines, and technology, how have you accomplished, or what were your accomplishments in terms of medicine and its procurement process, making sure that those who need medicines are having a regular supply of these medicines that they need? Okay, in terms of service delivery, what are your accomplishments in terms of health promotion, in terms of disaster response and mental health? Okay, these are what I'm going to look into. And the second problem would be the same as the first problem, but I'm going to look into the challenges that the province have faced, especially that we had the COVID-19 pandemic. What were the challenges that they have faced in terms of the six building blocks again? What were these challenges? How has these recent changes in the health system, like, for example, the enactment of the Universal Healthcare Act. We have the Philippine Mental Health Law. We also have events in health, such as the COVID-19. How has these affected, and what were the challenges that they have faced in terms, again, of the six building blocks? Now that we have determined the challenges, we are going to the third problem, which would be the strategies implemented by the province in response to the challenges that they have faced, in terms, again, of the six building blocks. Okay? And the fourth problem would be looking into the opportunities available for the province to improve and sustain its mental health system, again, in terms of the six building blocks. Now you might be questioning, why am I circulating on the six health building blocks? It's because in the universal healthcare law, the law espouses that we need to have a whole of government, whole of society, and whole of system approach. That's exactly why I'm using the whole of system approach, which is subsumed in the 6 billion blocks, into analyzing the public mental health system of the province of Benguet. Okay, so I hope it's clear. Now we move on to the unit of analysis or the level of analysis. Of course, I'll be analyzing the mental health professionals at an individual level, especially in terms of service delivery and health workforce, and the aggregates level or the organizational level, because I'm going to look into the response of and accomplishments of the province level, and of course the 13 municipalities. How are these local government units, the municipal local government units, and the provincial local government unit in terms of mental health? The locale of the study would be the province of Benguet and of course its 13 municipalities. I would be interviewing mental health coordinators both in the provincial level and in the municipal level. I would also be involving the mental health coordinators of district hospitals, because these are public hospitals, and the general hospital in the province. Now, why why did I choose the province of Benguet as my locale of the study? Because in 2019, along with Baguio City, they were the ones who expressed their intent to become universal healthcare integration sites. So along with Baguio, they were the pilot sites for the implementation of UHC. Now, since they have done that, they're able to progress well in their health. So I'm going to look into how has these affected the mental public health system. Is it behind? Is it behind the regular health system or public? Is it integrated in the regular health system, or is mental health different from that? Since we have been advancing, the province has been advancing in terms of universal health care, are they also advancing in terms of mental health? Okay, I did not choose Baguio City because it's a city. Okay, you know that the response would be different from Benguet. I chose Benguet because it's a province. It's wider. The scope is wider, and you can really see how public health is in the province because it's wider. You have a lot more to look into, especially in terms of the challenges. Now, the challenge in my research would be the availability of my participants, because I would be involving provincial and municipal level coordinators. I might also be involving doctors or municipal health officers. So their availability would pose a challenge in my research or my study. Since I also working, the conduct of the study may also be affected. Okay, I might not be able to juggle well the interview and the conduct of the study and my work. That could be a challenge. Nonetheless, I think I would be able to pull off this research since I am in the DOH. I can integrate this in my work. Okay. For my topic, my first topic is on public health. My second topic would be specifically on the industrial organization psychology side. So I'm talking about job satisfaction and turnover intention, because lately I've read a lot of articles or studies saying that job satisfaction has been lowering in healthcare providers among rural health units not generally in the Philippines. And we can also see a rise in the number of people or the number of health professionals going outside of the country. So how I'm curious at what is the influence of job satisfaction on turnover intention. So the study would be job satisfaction and turnover intention among rural healthcare providers in the Cordillera Administrative Region with the aim of determining the influence or the relationship of job satisfaction and turnover intention or on turnover intention among rural healthcare providers in the Cordillera Administrative Region. The first problem would be knowing the level of job satisfaction among the respondents. Statistically, I'd be using descriptive statistics here to determine the level of job satisfaction, weighted mean and mean. What is the second problem would be what is the level of turnover intention among my respondents? Okay, I would want to know that also. Is it high? Is it low? And I will also be using descriptive statistics for this. For the third problem, what is the difference in the level of job satisfaction among the respondents when they are grouped according to first demographic characteristics such as the age, sex, and educational attainment, and letter B, job characteristic factors such as their position in the organization, their weekly working hours, their monthly income, their years of work experience, their status of tenure, and hiring agency. Now, these grouping factors have already been tested to influence job satisfaction. Now, I'm curious if these are also true to people or to healthcare workers in the Cordillera Administrative Region. My alternative hypothesis would be there is a significant difference in the level of job satisfaction among the respondents when grouped according to those I've stated earlier. Okay, what will I use to determine if there is a significant difference? Inferential statistics, particularly ANOVA and t-test. Maybe if age for age, if I already have two groups, then I'll be using t-test. Definitely for sex, male and female, I'll be using t-test. Okay, but if I have three or more groups in each of the characteristics or grouping factors, then I would be using ANOVA. Okay. All right. So since I've also determined the level of turnover intention, I'm also going to look into the difference. If there is a difference in the turnover intention among the respondents when they are grouped according to the demographic characteristics and the job characteristic factors. Of course, my alternative hypothesis would be there is a significant difference in the level of turnover intention among the respondents when they are grouped according to the following, or according to what I've mentioned earlier. Like for example, if I found out that younger health workers have lower turnover intention than older healthcare workers in terms of age. In terms of sex, male health workers have a higher turnover intention rather than female healthcare workers. Educational attainment, of course, nurses have a higher turnover intention. So things like that. In terms of position in the organization, those in the lower or the rank and file healthcare workers have a higher turnover intention than those in the upper part of the organization. Things like that. And of course, I would like to know if really job satisfaction is able to influence turnover intention among the respondents. And my hypothesis would be there is a significant influence of job satisfaction on turnover intention among the respondents. Unit of analysis or level of analysis would be individual level. I'll be looking into rural healthcare workers or health providers in the Cordillera Administrative Region. So on that level, I would not be going into a higher level or an aggregate level or organizational level. Okay. The locale of the city would be Cordillera Administrative Region. I'm planning to have a stratified sampling or a stratified random sampling. Each of the 6 provinces and 1 city should be represented in my study. So we have Abra, Apayao, Benguet, Baguio City. We also have Kalinga, Ifugao, and Mountain Province. So all of these six provinces and 1 city would be included, and it would be prorated. Those who have higher number of healthcare workers would be having more representation in the city. The challenges would be availability of the respondents of the city in answering the questionnaires. Data gathering may also be costly since it would involve respondents from the different provinces of CAR. So I'm planning to have the questionnaires administered online, and if available, I can also administer it face to face. Okay. Now I have my last topic, which is indigenous belief system on mental health, particularly about Psikologiyang Pilipino. And my title would be Mental Health Belief System of the Indigenous Peoples of Benguet. My aim or objective is to examine the mental health belief system of the indigenous peoples of Benguet. Since according to the National Mental Health Research Agenda, they're looking at how are the belief systems in the province, or what are the indigenous cultural belief systems on mental health, because this could have been affecting their mental health seeking behavior. It's also affecting the way they are handling mental health problems. Number 1 problem would be, how is mental health interpreted by the indigenous peoples of Benguet? What are their definitions of mental health? How do they conceive mental health? Second problem would be, what are the practices of the indigenous peoples of Benguet that contribute to achieving mental wellness? Not necessarily what are the cultural practices that may be contributing to mental health. How do they respond to mental health? If a person is having, if they think that a person is having a mental health problem, what do they do in response to that? The third problem would be, what are the practices that may be detrimental to achieving mental wellness? I know this might sound a little negative, but it's also nice to know what are the maladjusted cultural practices, so that they could be not sustained. They should not be sustained as a cultural practice, because it is detrimental to the mental health of their tribe or the people in their cultural community. And the fourth problem would be, what are the similarities and differences in the mental health belief system of the indigenous peoples of Benguet? So these indigenous peoples or indigenous cultural communities living in Benguet, do they necessarily have a difference in mental health belief system? Or is it just the same? So things like that. I would want to explore on that. The unit of analysis or level of analysis would be aggregates level, since I'm talking about communities or group of people, indigenous cultural communities. The local of the study would be Benguet Province, and it would be conducted from May 2023 to December 2023, just like the other 2 topics I've mentioned. The participants would be indigenous peoples of Benguet such as the Ibaloys, the Kanais, the Kalangyas, and the Karaos. Okay? These are the four dominant indigenous cultural communities in the province of Benguet. Indigenous peoples or indigenous cultural communities. The challenges would be, I believe, seeking free prior informed consent or FPIC, because this could be a tedious process required by the National Commission on Indigenous Peoples before conducting a study.